you would place the needles in a like specific spot, and then you're hooking up electrodes to it. And then what are the electrodes doing?
They're driving electricity into the muscles, causing them to twitch and fire.
Okay, and how does that work versus, what's the benefit to having the electric stimulation? What is that doing?
So if you think about it, tissue fiber, everything comes from electrical impulses, whether it's like the propagation of impulses to allow for the actin and myosin that make up the tissue fiber to contract and relax, to come together and come apart. So this is driving electricity into the tissue to change the threshold that the tissue is operating at so that they can contract and relax easier.
Okay.
Yeah, so it allows us to kind of give a reset to the muscles, gain motion, decrease tone. So, for example, everyone's upper traps are tight, right?
Yeah.
Everyone's upper traps are tight. We all carry tension there or terrible posture. Posture's a whole different thing.
Yeah.
The only posture that's terrible is none of them, because posture is whatever you change into. But posture, we all have trigger points. So we take a needle, drive it into a trigger point where the tissue is just like super bound up.
Uh-huh.
The electricity goes through it, allowing contract, relax, get the pump of fluid back into those tissues. Because that's what makes a trigger point too, is ischemia. So the tissue is bound together and not getting any blood.
Oh, okay.
So now we're facilitating a pump.
Interesting.
And now we're getting those fibers to come apart so that they can contract and relax.
So in your experience, is this pretty effective?
Oh my gosh, it has
Really?
changed my practice.
Really?
Yeah. It is just a modality like everything else.
Uh-huh.
But the lasting effects of dry needling with e-stim has changed the way I can load up my patient, decreases irritability, it pumps the inflammatory factors out of the area so that there's not so much pain.
Uh-huh.
And then we can get them back to other things. Like, I never needle without loading, meaning strengthening the same tissue after.
Mm-hmm.
So we'll needle and then say it's upper trap skin, needle, and then we're going to go and do shrugs after the needles come out. So now that we have all this new movement in the tissue, let's go use it.
Yeah, for sure.